Carolyn Farmer has been a caretaker for her sister for over 10 years. She may not have had any physical pain while taking care of her sister, but the mental pain has taken a toll on her.
Well, I noticed as the years progress that she's becoming a little difficult. She's becoming more demanding, though the doctor said that her condition has not really changed.
Miss Farmer also explains how taking care of her sister can be very trying on her some days. Dementia caregiving can last from 4 to 20 years, so there's no way of predicting how long people living with dementia will be impacted by this terminal condition.
But the physical demand of taking care of someone with dementia, once they get real bad, besides trying to physically just change them, bathe them, get them moving and all that, but physically it wears on you because you can't get any rest and you're fatigued and worn out. So it just, you just get drained.
I said some days it's like hell. It's like hell. Just constantly repeating myself. Like 2 weeks ago, we had a plumber over. The plumber came. He called me, said, "I'm on my way over there." I called her. I said, "I'll be there shortly." The plumber came. I told him, the situation with her, and he came. He told her who he was, and he got there like maybe 10 minutes before I did. He did the job that I required him to do, and we're upstairs talking, and then she asked him, "Well, who are you?" She knew he was the plumber. He said, "I told you, I'm the plumber," and just that quick. And then a few minutes later, she knew who he was, but then a few minutes later, she realized. Then she asked him again, "Who are you?" And then after he left, she said, "Well, what did the plumber do?" Things like that. And then after a while was, nothing. Situation.
There is, however, an app called Circle of, an app for family caregivers to help organize, collaborate, and ask for help when needed. Carrie Lang, COO and Chief Evangelist of Care Of, talks more about the app.
A few years ago, our CEO, Michael Jordan, was in an innovation hub, which was several large companies like Cisco, Apple, UCSF. They all got together, brought a bunch of patients into a room and their care teams, and spent the weekend trying to figure out how they could best serve the patient needs. And one of the opportunities that came out of that was that actually there was a realization that caregivers around patients weren't actually getting as much support as they could. And so our CEO decided to pursue this idea of creating an app that would actually help family caregivers, so the unpaid caregivers, actually help them manage all of the logistics and functional sides of caregiving. And first and foremost, the most important part being bringing in people to help support that caregiving experience. Yeah, it was really designed to help facilitate just the general basic caregiving needs of a patient. So it's everything from, making sure that meals are taken care of, appointments, tasks, maybe a patient needs their kids picked up at school or medications or the dog walked, just sort of the basic things. So that's really what Circle Up is about. We know through our research that a lot of caregivers, and having been one myself, many caregivers take on the whole burden of caregiving and they feel guilty asking for help. They don't either know how to ask for help. They feel uncomfortable asking for help.
It's tougher. It's a little bit tougher for an at-home caregiver than it is for if there is such a thing as an average patient. For us, we have a very athletic demographic. A lot of CrossFitters, weightlifters, endurance athletes. So when we get a caregiver, it's a little bit different because those endurance athletes, you can tell them they need to scale back. You can tell them they need to stop doing X, Y, and Z for a certain period of time. You can't really do that with a caregiver. They have to continue on whether, we want them to or not.
They think nobody's going to sign up for help. They don't know who to ask for help. So we feel like our app is really giving them the tools and the easy ability to say, hey, I need to take a break. Can somebody, maybe somebody can pick up my kids so I can take mom to the doctor, to really bring people into that experience so that the caregiver knows they can get support when they need it, when they need to take a break and go take an afternoon off. They can get the just the emotional support.
We're kind of a specialized subset of the chiropractic field. We do more rehab, so most of our patients come in with specific injuries, whether it's shoulders, low backs, hips, knees, things like that. And so we do a lot of soft tissue work, it's very similar to PT, to get them fixed as quickly as possible. The whole healthcare system is really kind of flawed, in my opinion, anyway. And I see that both on the provider side and on the consumer side. Insurance companies just don't want to pay for the services that we have. And we really pride ourselves on getting people fixed quickly, generally 3-4 visits and you're back out to doing your thing. But in order to get somebody better quickly, we have to be able to spend time with them while we're treating them, and insurance companies don't want to pay for that. So in fact, we, as of a month ago, have left all insurance networks, which means all of our patients who are coming to us are paying out of pocket for everything. And that's tough. Our appointments are not cheap. They're effective, but they're not cheap. And that's hard if somebody's on a limited income and doesn't have a whole lot of disposable income. Nobody plans on an injury. Nobody plans on getting hurt. And so when you have to shell out, $150 an appointment, that's that can sometimes be cost prohibitive. So yeah, I think I would love to see in a perfect world where insurance companies pay us for what we do, but I don't know of any provider, any doctor that thinks that's adequate.
But even though these families may struggle with being personal caregivers, there is some light within their struggle.
Yeah, she depends on me now. She's always telling me, I don't know what I'd do without you, things like that. Yeah.
It's still, however, great to know that at the end of the day, people living with dementia still have people around them that love and care for them.